So good morning, good afternoon, and good evening, everyone. Thank you for joining us for our June of 2021 Global One Health Initiative webinar supported by the NIH Fogarty International Center. Today, we will be hearing from Dr. Armando Hoet from here at The Ohio State University. And Dr. Hoet will be presenting on the FAO Progressive Management Pathway for Antimicrobial Resistance. After Dr. Hoet has presented, we will have a panel discussion or a Q&A session. So please hold your questions until the end of the presentation. And I would like to go ahead and briefly introduce Dr. Hoet. Dr. Hoet has a DVM from Zulia University, Maracaibo, Venezuela, a PhD in Veterinary Preventive Medicine from The Ohio State University, and a Diplomate in the American College of Veterinary Preventive Medicine, or ACVPM, currently serving as a counselor on the executive board. He has been teaching and performing research on infectious diseases since 1993, publishing over 75 research articles and book chapters on infectious disease. His current research interest is on the epidemiology and ecology of zoonotic and foodborne pathogens such as MRSA, E. coli, and Salmonella, as well as the molecular epidemiology of antimicrobial resistance associated with these pathogens in humans, animals, and the environment. And recently, Dr. Hoet was named a One Health Scholar by the Association of the American Veterinary Medical Colleges for his tabletop exercise, Q Fever in the Suburbs. And currently, Dr. Hoet serves as the director of the Veterinary Public Health Program here at The Ohio State University, which is one of the ACVPM accredited, or only two ACVPM accredited programs in the United States, and the second largest in the country. He has visited over 41 different countries and has international experience with managing research, educational and service projects focusing on countries such as the United States, Venezuela, Uruguay, Costa Rica, Chile, Colombia, Ethiopia, and multiple countries in the Caribbean, including the OIE Twinning Program and the Caribbean Integrated Surveillance System on Antimicrobial Resistance in Agriculture program. And he has delivered over 130 invited presentations at national and international scientific meetings and institutions of higher education. Today, Dr. Hoet will be speaking to us about his sabbatical experience working at the Food and Agricultural Organization in Rome, Italy, focusing on the FAO Progressive Management Pathway to help countries implement their own national programs on AMR. And with that, I will hand it over to you, Dr. Hoet, and you may share your screen whenever you're ready to begin.
Thank you, Laura. Let me share my screen here, moving things around. Can you see it?
Yep, there, it's now loaded. We see your background right now. There we go. Yep, perfect.
Good. Well, thank you, Lara, for the introduction, and thank you for the invitation today that allowed me to be here to share some of my experiences in working with the United Nations Food and Agriculture Organization, specifically with the Progressive Management Pathway, the PMP team, and the AMR core group at the headquarters in Rome. Dr. Dubrev asked me to share with all of you a little bit of the experience of putting together this particular approach to manage antimicrobial resistance, which, as we know, is kind of the major silent pandemics that we are dealing today worldwide, okay? So I will assume that everybody in the call, in the webinar today, understand how serious antimicrobial resistance is today. So I will not go into the background about antimicrobial resistance. I will just go directly to the PMP, okay? So this is kind of the content or the points that I'm going to cover today with you, a little bit about the problem that we're trying to solve through the progressive management pathway. Explain a little bit of the philosophy of the PMP, talk about the structure of this particular tool that the FAO have developed to help countries to design and not design, to kind of determine the level of implementation of the national plans for the food and agricultural sector, and to help them to develop an action plans so they can keep implementing it, revising it, expanding or consolidating according to the case, so they can really properly use antimicrobials and manage antimicrobial resistance. And then I'm going to describe a little bit about the assessment tool, what it is and how it works and how we use it. And then a little bit of the workshops that we have implemented already in 7 different countries worldwide, and the ones that are coming these 2021 and 2022. So we go directly to the point. So I believe that most of you are already familiar with this Global Action Plan on Antimicrobial Resistance. So in 2011, 2012, the World Health Organization put together a document that allowed the countries to develop a national plan that it is a One Health kind of approach, that use a One Health approach to develop the national plans to manage antimicrobial resistance. So this particular document provided a roadmap for the countries to develop the national plans that were expected to have it in place by 2015. Then since then, most of the countries worldwide have developed a national action plans to manage AMR. And in this national action plan have been implemented at different levels across the countries worldwide. So in the case of the United States, we have really advanced in regards that we have a national action plan. Right now we're going to a second edition of that plan, and it details very specifically what are the different components that we're going to have in the national action plan. But what is important for us, for the people here in the webinar, is that as part of the national action plan, or that umbrella of the national action plan, there are specific components of elements that are specific to the food and agricultural sector, okay? So you can see in there like a surveillance from farm to table, everything that has to be used about antimicrobial use in animal populations and so on. So the problem with that is, or not a problem, the challenge with that is, as you build your national action plans, you also have to build inside that national action plan your own food and agricultural action plan as a component of the whole plan. And that's a challenge because sometimes the governments have an issue that, okay, how we bring all those complex issues together into a plan. And to help with that process, the FAO in 2015 put together a plan that was called, as you can see it in the screen, the FAO Action Plan, that provide some kind of footprint or roadmap for the countries to develop the food and agricultural action plan for antimicrobial resistance under the umbrella of the Global Action Plan, okay? And this is extremely complex. As you can see, of all the issues that have to do with antimicrobial resistance, you have in the human side, but then all the agricultural and animal side is significantly complex. And therefore, these particular documents was designed to help the countries to understand what needs to be there, what activities they need to be targeting, and how they can put all those together. A little bit of a breaking news. I'm very glad to say that just last week, I got notified that the FAO Action Plan for 2021 and 2025 have been approved. And happily for me, I was there in Rome when these plan started to take form, and I was part of the core editorial team. So I'm able to see the whole design process until what is today and be able to contribute with some of the experiences that are going to be talking with you today in the development of this plan. It will be published pretty soon. Right now is in the graphic designers, and it will be in September, October this year, circulating in your mailboxes. Now, these FAO action plans, again, are designed to help the countries to develop their national action plan for the food and agricultural sector. And I put it in quotation marks is because, remember, each country have a national action plan, and inside that, it should be a specific one. If you wanted to call it a sub-plan or a program, every country call it different, that has to be specific for the food and agricultural sector. That needs to cover not only the animal side, but also aquaculture, crops and fruits and all the different agricultural elements that can have a component or an association to antimicrobial resistance. And also, of course, that include the environmental component. Now, sadly, I cannot see you at this time because normally trying to make this part interactive, but what do you think it should be the end goal of the food and agricultural component of an action plans to manage and control AMR? Okay, and the answer to that is very simple. It is twofold. Okay, any food and agricultural plan that is designed out there in any country, the US, Canada, any Costa Rica, Chile, whatever country you name, it have these two main objectives. One, to provide guidelines about the prudent use of antimicrobials in the agricultural sectors and to enforce those guidelines and standards. And the second part is to fully monitor and prevent AMR in the food and agricultural sector, okay? And so when you decide the plans for the food and agricultural side, you have to be sure that they accomplish both, not only one of them. Okay, so let me ask you this. What do you think is the ideal status that a country should reach to sustainable use antimicrobials, the first one, and to fully manage AMR, the second one, and the food and agricultural sector? So what do you think a country should be doing today to make sure that we can do these two things? So let me give you an example, okay? A country that is fully developed and have full control and management of AMR should be doing regular awareness communication campaigns targeting all commodity groups, again, from the animal side all the way to crops and fruits and the environment, and the general public. We need to be teaching them about the proper use of antimicrobials, how the farmers definitely need to use it correctly, what is prudent use and good practices and vaccination, but at the same time, how to manage infections and clean and disinfection and all of that. A country that have a very good national plan for this sector should have these type of training on a regular basis for workers, for farmers, for the general public, for everybody else that involved in this side. Another things that the countries need to be doing at that time is they have to be doing regular antimicrobial resistant training and antimicrobial use training for all the professions working in the food and agricultural sector. So we're talking about veterinarians, agricultural engineers, animal science, para-veterinarians. So anybody that works with antimicrobials or has something to do with antimicrobial resistance, if the country is really managing their AMR problem well, they should have regular continuing education trainings and regular ways for these individuals to be educated in the new technologies, the new science, and the new knowledge. But if you keep doing that exercise of what a country needs to be doing ideally to control antimicrobial resistance, to manage antimicrobial resistance, and to apply proper use of antimicrobials, it will be dozens of things that they need to be doing on a regular basis that needs to be included inside their national action plans. So you can imagine that is a major challenge because every country is different and at different levels of stage. You can have countries like Denmark or Norway that are highly advanced, and then you can have countries that probably are just starting to discuss the issue of antimicrobial resistance in their homeland. Now, the questions normally get asked is, okay, perfect. We understand that to be able to ideally manage AMR, we need to be doing all that kind of stuff. Is how we reach that status, how we get from whatever situation we are to a situation we can really doing this well, okay? And this is the goal, okay? How you can really have a sustainable use of antimicrobial. And sustainable mean is that you don't lose them because of antimicrobial resistance. It means that these particular management and plan allow you to maintain the antibiotics as long as you can without the need to create any new ones. And the second part is that you are able to monitor, prevent antimicrobial resistance. Again, the two major objectives of your national action plan. Now, even though it sounds simple, The World Health Organization have a roadmap of how to create the national action plans. FAO give you the guidelines and recommendations to create the food and agricultural side for your country. And a study that was done in 2018, 3 or 4 years later after that mandate, it find out that in most countries, the greatest challenge is not writing these plans. It's very easy to write them, right? You put a bunch of people in a room and you ask them, tell us what we're supposed to do. And you say, okay, we will go around country A and we will do this many training for veterinarians, para-veterinarians, agricultural engineers, and so on. But the truth is the majority of those national action plans only stayed in writing and they never get implemented, okay? And the only way that the country know where they are is that you have a way to assess or audit their status of these national action plans at a particular time, and then use that in a way to recreate or produce a new action plan for the country so you can really move forward. So setting very specific goals to which you're going to be moving to. Okay, and here comes the progressive management approach. So what is that? So this approach is designed to help countries to go to one specific status of whatever the issue is to the ideal one or the ones that allow them to control the particular problem. So the FAO created many years ago what they call the progressive control pathway, exactly in 2008. And this is basically a step-wide approach for the country to go for whatever status they are to a particular goal. In this case, when they created this PCP process, it was the elimination of an animal disease in that country. So they normally have very specific steps that allow the countries to go or to place themselves wherever they are. And we go from the assessment, what is the current situation of that disease, the prevalence, the incidence, the epidemiology, and all of that, through measures and interventions that allow to decrease or reduce the amount of disease in the population, in the animal population. Eventually, when you reach certain points, like in brucellosis or tuberculosis, you start to talk about elimination. And finally, you go to the point of eradication or search and destroy, basically, like in the case of foot-and-mouth disease, until finally the country is completely free of the microorganisms or the disease, and they can pursue certification through the OHi and other organizations to determine or to indicate that indeed they are free of X or Y disease in their country. So this statewide approach is very specific, and you will develop action plans depending on what step you are to make sure that you are moving forward to a particular goal. So this is extremely important because it helps the countries to identify what is the next step, not the ultimate goal. So if you are only in the assessment one, okay, what are the first interventions you need to do to start to at least to know what is the epidemiology of the disease in your country? Then that's your first step. And eventually over the years, you will get where you want to be. It helps to develop a systematic framework. Again, any activity that you do has a purpose to accomplish a particular goal, a particular performance indicator that allow you to go to the next level and then to the next level and then to the next level. And finally, it allows you to determine if whatever activity intervention that you put in place is really working, okay? So you need to see if you're making progress or you're not making progress at all. So you don't have a stepwise approach that is going to be extremely difficult to determine. So they developed that a particular approach and they implemented for the first time with the foot-and-mouth disease, which, as you know, have been incredibly successful because most of the countries worldwide right now have almost eradicated this disease, or it's extremely under control and it's just very close to countries in step 4 or something like that. Step 3 going to step 4, most of the countries worldwide. So as you can see, they started stage 0. So they have not started anything yet, and they will go all the way to stage 4, and eventually the official status jump into OHi, which you have either compartmentalization or you only need vaccinations to maintain your status and then you move on, okay? It works really, really well to eradicate and to control and eradicate this disease. Because that approach worked so successfully with foot-and-mouth disease, then it was followed by pestis ruminalis, okay? And the same kind of approach. different type of stages, which stage 1 is when you're starting, you have no data, all the way until finally you reach the complete eradication of the pathogen and you are declared free of this disease. So this disease is very close today to be eradicated. And again, it allows you to go one step at a time. No matter where you are, eventually if you are in stage 2 in the country when you start, then you move from that stage forward. And then they applied it with rabies, same thing. They have been able to eradicate rabies in many countries following this statewide approach, African animal trypanosomiasis and brucellosis and so on. So this is a proven methodology that it really helps the countries to assess where they are, develop an action plan, implement it, measure progress, reassess, restructure, create a new action plan, and then move forward to the next step, all the way to the end goal, and in this case, eradication of a disease. Okay, so perfect. Now, my question to you guys is, can you eradicate antimicrobial use in agriculture? I think, Laura, I don't know if they're able to put information in the chat. It is something that they can do, or this is not.
Yeah, so people can either raise their hands and we can unmute them, or they can put their answers or responses in the Q&A box.
Perfect. So use the Q&A box and tell me, answer these, yes or no. What do you think? Can we eradicate antimicrobial resistance or antimicrobial use, in this case, in agriculture? What do you think? Can we stop using antibiotics at all in agriculture? No, we can reduce. Very good, Ashenef. That's correct. We can reduce it, but we cannot eliminate it because it's an issue of animal welfare, right? You cannot have a cow or an animal. Thank you. No, definitely not. What about the next one? The next question. Can we eradicate antimicrobial resistance? What do you think? Give me your opinion over here in the chat in the question and answer. Can we fully eradicate antimicrobial resistance? No. Why not? Because this is a biological process. It's an evolutionary process. The bacteria, the viruses, and the parasites, it is part of the mechanisms of survival. So you are not going to be able to ever eradicate antimicrobial resistance. You can slow it down, you can manage it, but you cannot eliminate it. So the progressive control pathway, thank you for those that are saying definitely not. It is not possible to do that. So the original idea of a progressive control pathway to be applied for antimicrobial use and antimicrobial resistance, it is not possible, okay? So that's why for the particular tool that I'm going to talk today, we decided to call it the progressive management pathway. Why management? Because it's an statewide approach, going from stage 1 to stage 4, to reach an ideal status in which allowed to have a comprehensive management of a complex multi-sectoral issue that lack a specifics endpoint. We're never going to eliminate antimicrobial resistance. We cannot stop using antimicrobials in animal populations because of ethical and moral issues and production issues. Okay, we want food. And so we cannot talk about control because we will not be able to ever eradicate it, but we can definitely manage it. So we normally, when we design this progressive management pathway, we start with, okay, what is the ideal status that you can say that you're properly using antibiotics and that you're properly monitoring the problem and that you're properly managing antimicrobial resistance. And that's where we come with this progressive management pathway. It was launched in 2019 when a group of experts led by Dr. Hoet from Belgium. He is one of the main consultants and the main designer of this particular tool, put together a group of international experts and then got a particular question. What is the ideal status in which countries need to be for them to be able to manage antimicrobial resistance, and what is the proper statewide approach to do it, okay? So you can read it in there. It was just designed to help countries to develop, and very important word, operationalize. It means to help them to implement it, okay? So we want the countries to be able not only to write their food and agricultural action plan, that they implement it. So it has to be something that can be actionable. And then we work with the operational side as we do in the PMP analysis, okay? And it's a stepwise approach. We normally go, in our case, for stage 1, that is assessment. Where do you are in regards to regulations, good practices, prescriptions, environmental monitoring, surveillance of the food supply, education of the producers. Where are you in that particular item? In the case, we have awareness. So we can say, okay, where are the different stakeholders across the agricultural sectors in regards of the issue of antimicrobial resistance and antimicrobial use. And then once they have reached certain milestones in that stage, that you know what you have in your country, then you can go to stage 2. And then stage 2 is basically you start to implement small scale or pilot scale level interventions. The priority production systems, either poultry or swine or small ruminants or aquaculture, it changes by each country. And then you start to do small activities in all the different areas that you require to manage AMR and to properly use antimicrobials. When you reach certain milestone and cutoff points, then the country will move to stage 3, in which you start to apply now that experience that you're obtaining in these small scale, targeted or pilot interventions. You start to make those national, and you start to apply those national plans to the key priority production systems in the countries, whatever they are. And eventually, when you have that fully functional and working year after year, then the country will evolve to a stage 4, which is the ideal stage in which you're doing the same kind of process, but this time, not only nationwide, and not only to all the key priority sectors, you're applying it to everybody, to the crops, to anybody that is producing corns or fruits or potatoes, if they have a role in the antimicrobial resistant issue, and if they have a role in the use of antimicrobials, that sector should be included in that stage 4. If that's the case, it means that the government or that particular country is really managing AMR properly at that time, okay? So what is the structure of the current PMP antimicrobial resistant program in FAO? There are 4 major focus areas that are part of this program. This awareness that have to do with basically education and training, kind of the, education and training component of anybody involved in those 2 issues. It is evidence, that is just a fancy way for surveillance and monitoring and research. So what do we know about the prevalence and incidence of antimicrobial resistance, about the use of antibiotics, what are the most common pathologies in the countries that force the farmers to use antimicrobials, and so on. And then we have governance that have to do, as the name implied, everything that is regulations and standards and guidelines and laws and so on. And finally, practice, which is a combination of good management practices, biosecurity, vaccination, and everything you do to try to either avoid the use of antibiotics by preventing diseases, or that if you have the diseases already circulating in a population, in a farm, how you do the proper biocontainment. It means that to avoid or minimize the spread of multi-drug resistant infections in a farm, in a region, in a country, okay? So these are the 4 focus areas that we cover. Each focus area have 4 stages. If you can see in there, this example that you see in the screen is awareness. And it will go again from the assessment in stage 1 all the way for full awareness programs implemented nationwide to all the sectors that have to do with the agricultural side, okay? You have a gradual inclusion of specific activities. Again, very simple at the beginning and extremely complex at the end, which is normally the status for any one of us. It's like a career progression, but at the country level. We applied a One Health philosophy and a multi-sectoral approach. You will see in a few slides from now that this is not only involve the Minister of Agriculture or the food sector. It doesn't involve only veterinarians or related personnel. It doesn't involve only farmers and producers. This involves industry, the private sectors at different levels, involves the consumers, involves the Minister of Health, involves all kind of organizations, because the AMR is a complex issue that circulate widely into the environment, all around us, in our communities, in hospitals, in our households, in the beach, in the rivers, everywhere. So if you don't have all the different individuals involved in the design and implementation of your plans, that plans will not accomplish the main two objectives that I described before, okay? Now, I'm going to give you an example of how this is implemented when we go to the countries. So if you remember this one, okay, ideally we have regular trainings on antimicrobial resistance and antimicrobial use for producers in all food and agricultural sectors when we are in stage 4. Okay, that sounds easy, right? How'd you get there? How you go from only a couple of trainings a year to mostly poultry producers, but we completely ignore cattle producers, we completely ignore swine, small ruminants, camelids, whatever, and we don't include anybody that produce fruits or anything else from the agricultural side. So how we go from wherever you are to that ideal stage of full coverage nationwide. So if we go into the awareness, and the main topic here is training of producers, stage 1 is first is kind of doing an inventory of the existing training. What are you doing at the country level? Who is doing it for the food and agricultural producers, livestock, crop producers, anybody that use in agricultural side antimicrobials should be listed here. And what the different organizations, universities, producers associations, government, private industry is doing in regard to training, how we are educating them, what is being educated to them, what is the level of complexity of that. Once you know what you have, then you go to a stage 2. So stage 2 is you start to develop and organize small scale training courses for antimicrobial resistance and MOU for agricultural producers in key commodities. So you're going to do an assessment prioritization process in your country, and the top 3, top 2 of the country, the ones that generate more food, the ones that are more important for food security, or the ones that generate major income because of trade and exports, those are the ones that you will include in these original trainings and small scale. Those are your main target. Once you do that in a routine basis, then you have accomplished stage 2. Then eventually you go stage 3. You use that experience and of a smaller scales, probably regional, close to the capital, or in some major cities or production regions. Then you make that nationwide, and you still maintain key commodities. So you go from small to large to be able to reach your stage 3. When you do that to all your priority sectors nationwide on a regular basis, congratulations, your country have accomplished stage 3. And then eventually you go to stage 4, in which you're going to do the same thing nationwide on a regular basis, but now you should include all the food and agricultural sectors. That doesn't mean that every year you have to do a particular training for, like, say, fruit producers or something like that. But if they're producing oranges and they're using streptomycins and some other kind of antimicrobials in the oranges, probably with a training every 3 years, every 4 years, as long as it's on a regular basis, it is organized, there is a program, there is a target, then this country is properly managing this particular training of producers to manage AMR and to manage the prudent use of antimicrobials, okay? So now, as I mentioned, we repeat that with each one of the 4 major focus areas. So we have awareness, we have evidence, we have governance, and then we have practice. And each one of them have multiple activities with multiple topics, with multiple outcomes that is expected for the countries to move forward. Give them targets to be systematically moving toward an ideal management of AMR. Okay, perfect. I understand the philosophy. I understand that this helps the countries to organize themselves, to develop their action plans for the food and agricultural sector under the national action plans. How we know it's working? How do we know that it's indeed we're doing it what we're supposed to be doing? Are we really having an impact? Are we making a difference? That's when the FAO developed the PMPMR assessment tool. So this is a tool that is provided to the country with some support and facilitators and managed from the FAO, in which allow the country to determine where they are, in what stage they are in the different topics and in the different activities, and then helps them to design the next step. So this is a short screen of the that evaluation tool, okay? It allowed the country to self-assess, to determine, based on the specific activities they are performing, where they are in the different stages for each one of things. So here, in this case, we have awareness, and then we have awareness assessments and awareness campaign. What do the people know, and what are you doing to educate them? And they go parallel to each other. So you can see there are different stages of knowledge, 1 to 4 always. And we have what we call key performance indicators, the KPIs. The KPIs are kind of the end point of that particular stage. When you have done X or Y in that particular activity, it means the country, if they're doing it on a regular basis, have a system in place to do it on a regular basis, you have reached that KPI. When you reach that KPI, you can say that your status is complete, then you will go to the next stage, okay? And again, the philosophy going from a small scale pilot projects or activities all the way to nationwide, and always using a One Health approach. This is something very important of the tool. Once the country has done its self-assessment, you will get the dashboard. So this is something that is populated, and it will let you know, for example, in this particular country, in regards to awareness, half of their activities, okay, are being completed for the stage 2, but half of the activities in regards to awareness of the topics are still in stage 1. It means that either they have not started or they have still not reached the cutoff or the KPI for them to go to the next level. When we go to evidence and surveillance, you can see that most of these activities, they start to move up and they start to get better and better, but they are definitely far away. When we go to governance, they have already completed almost 100% of all the activities and topics that should be reached in stage 1. Of course, they have moved to stage 2, and they're really advancing governance. But you can see that everything else is lagging behind. So even though they have the rules and the regulations in the books, they are not probably being implemented in the field. There is no funding, there is no budget, there is no organization that is really pushing those changes and regulations and standards that the government is setting. But from the governance point of view, they're doing extremely well, and they're already working in stage 4. Finally, in the case of this example, we have in practice, 75% of stage 1s are almost completed, and 50%. So still they have a lot of work to do in regards to that. So that's the usefulness of this tool that allow to know what is the current status, what are the areas that you are lagging behind, what are the areas you're doing extremely well, and then based on that information, prepare a plan that allow the country to move forward, okay? Do you think that it's interesting? We start to see now some of the pilot countries that did it 1, 2, 3 years ago, they start now to go back and repeat the self-assessment. Then you can compare these numbers of the dashboard against your own numbers 1, 2, 3 years before, and then you can see, well, wow, we were 50% in stage 1 for awareness. Right now we are at 80%. It means that we're definitely doing progress. So whatever we're doing is working, and then the country need to be moving forward. That is extremely important for the decision makers, because it's a way for you to justify budgets, to justify funding, to justify personnel, to justify to be part of the main priorities of the country or the governments of that country over time. So this observed progress over time is a major important item of this assessment tool. Something important I would like to highlight is the countries are the ones that own this information. So when they do the evaluation, the country has that information and they manage that information whatever way they please. All this information is maintained confidential, only between the country and Dr. Cohen and a group of facilitators in the headquarters and FAO, and they do not move or do anything with that data without any country approval, okay? The other important things that we want to highlight is this tool is not meant to compare between countries. Why? Because each country developed their awareness campaigns, for example, very differently. So there is not a way that we can say that country A is doing a much better awareness campaigns than country B, because this is not the purpose of the tool. The purpose of the tool is, are they doing it? Are they making any difference in their reality and based on the needs and circumstances of the country? And because it's so unique and so country adapted, it is not something that you can use and say, okay, let me compare country B with country D or with country F. That will not work that way, okay? So that's something very important. Then it's highly confidential. The countries own the data, and the country use that data to measure their own progress, and it cannot be used to compare with everybody else to see if they're doing well or not. Now, something that is also part of the assessment tool. So if we're talking about awareness, then at the end of that section, there is going to be other tools from international organizations, from major governments, for countries that have reached already stage 4 in that particular topic of activity, in which we provide examples that this is how people did it. Here are the tools that we help you to design specific plans for that particular topic or that particular activity. Or here are countries that have done that very successfully. Here's how they did it. Here's how they started, so you can learn from them. All that information is inside the tool. So when you're working in a particular activity, in a particular topic, you're going to see examples or guidelines or a methodology that will allow to put something together very specific for that particular topic, that particular activity. Then this is one of the most important things we do. So once we evaluate all the different activities and topics in the 4 focus area, we need to develop an action plan. So during the workshops that I'm going to show you in just a second, we are going to go in each one of awareness, in each one of the topics and activities that you need to be doing, depending on the stage where you are. It will be developed as specific actions. What are you going to be doing now? Then you write in there who is going to be the responsible of that and when that needs to be occurred. So normally that decision is made in a major workshop, which we bring the people from the Ministry of Health, the Ministry of Agriculture, Environment, Food Safety, the different professional associations, the veterinarians, the doctors, the nurses, in which we bring the directors of the different diagnostic labs and so on, and they together put this action plan real time, creating kind of a draft that in the next following weeks and months, they will publish until they finally end with their action plan to implement the National Action Plan for Antimicrobial Resistance, okay? So this is an example, one of the ones we did recently that, okay, we agreed that they have to develop the species-specific guidelines of prudent use of antimicrobials for the poultry sector. There are no guidelines at the country level, then they need to do it. So we name specifically who is the responsible. Office from the government is going to take the lead, and their poultry association and poultry producers are going to be the industry representatives, helping them to create those guidelines that will be eventually spread through the country. That is one of the major requirements for them to be able to go to stage 2 in the poultry sector. This is very important because it helps with resource mobilization. It means that if we need to do these guidelines, this government agency with the industry will identify what is the budget, who is going to implement it, the timeline, and everything else for them to be able to happen. So if you know that you need to have it done by January 2020, you will have to mobilize the resources of personnel, finances, physical space, and so on for you to be able to do it, the experts, the consultants, and so on. And again, the whole idea is to help to operationalize your national action plans for the food agricultural sector so you can move from one stage to the next and then maintain a full comprehensive status when you reach it. So when you reach stage 4, how you stay there, okay? And then maintain the antimicrobial resistance issue as a minimum problem for your producers, for your community, for public health, for animal health, and so on. So how we collect all that information, how we implement all of that I just described. So we have a workshop that is a 3-day long activity that is done in country, in which a group of facilitators that have been especially trained for this regional representatives, and so on, come into a conference room with us, and then we go and apply this evaluation tool with them in there. So all the key stakeholders are represented in these workshops, and key stakeholders that are relevant for the food and agricultural sector. So you can have in the human health side, the Minister of Health, the clinical diagnostics, the directors of those laboratories, the heads of the epidemiology divisions. Then we have the agricultural and the animal health sectors, the food safety sector, environmental. In many countries, the military play a major role, so the Department of Defense and whoever is working with AMR or MOU, it will be part of this committee. We normally have around 35 to 40 decision makers and stakeholders represented in this workshop, because each one of them play a different role in each one of the focus areas, in each one of the topics, and each one of the activities. It is open discussion, is managed by a moderator, and we are only reporting what the local representatives indicated, and we build the action items based on what they are setting their own self-assessments, okay? It is very interesting that in some activities we have done, the director of the human laboratory go across the table to meet with the director from the veterinary lab. Oh, nice to meet you. They probably know each other by name, but they had never been in the same room designing an action plan to operationalize the national action plans for the food and agricultural side. So this dynamic helped to create some of those networking opportunities in which they can work together to brainstorm sometimes solutions, and others to really set specific roles and responsibilities. It facilitates collaboration. So these workshop have been implemented in 7 countries. The last ones we did is in Tunisia. We just used that with what we call version 1.0 for the PMP tool. My job at FAO was to use the experiences of all these countries to develop version 2.0, which is the one that today is going to be implemented in countries like Costa Rica, like Morocco, like Barbados, like Senegal, and Laos, and Mongolia, and the list right now is closed. The goal is in the next year to implement it in at least 40 to 50 countries worldwide. And as the countries pick it up, eventually the majority of the members, especially low middle income countries, should be able to get access to this tool and be able to implement this assessment to see where they are, develop an action plan, operationalize it, and then move forward towards an ideal status of full management and control of AMR with a good, prudent use of antimicrobials in the agricultural side, okay? We are creating a manual as we speak. It's being written. And the whole idea is that eventually the countries will not need the FAO facilitation, that they will be able to do it on a regular basis. As I mentioned before, many of these countries that have been in the pilot version of 1.0, currently they are pursuing the second version or the second assessment, just to see how much they have progressed in the last 2-3 years of the implementation of these plans. So, as you can imagine, this is a titanic effort that had been led by Dr. Cohen Mittens. He is the lead of the PMP. So here are my colleagues, Yun King, Dr. Yunxia Song, that is the head of the AMR program in FAO, Antonio Barcarce, Yung Xu, and Lina Yu. They are our partners in crimes that have helped to implement these PMP in multiple countries and helping and guiding the countries in the self-evaluations and the ones they're going to be doing in the next year or so. And then you can see also regional offices all the way from Africa to the Pacific, in which the professionals that you see there have contributed with their opinions and their insights and their experiences and expertise in developing version 2.0 and in the application of this tool with the country, helping them to develop their plans. We also, as a tripartite agency, the FAO works, of course, with the World Health Organization, the Pan-American Health Organization, OAI, the World Organization for Animal Health, and the United Nations Environmental Protection Agency, which is basically the sister of WHO and FAO, but is specifically focused on environmental issues. So that's it. Thank you very much. If you are interested in obtaining more information, here are the email links to Dr. Cohen and to Lina Yu and others in the headquarters that they will be more than glad to interact with you. Just one disclaimer or clarification. This tool is available to the point of contacts of AMR for the country, specifically those working either in the food and agricultural sector, whoever is the official representative, or whoever is the person that is managing the National Action Plan. If you are in an academic institution and you're interested for the training educational purposes, you can reach Dr. Cohen, and then he will be more than happy to facilitate either a version of the tool that can be used publicly, as well as the manual when it comes out of the print as well. We are working, which is one of my roles today, on the e-learning training platform. So we will be able to provide you videos that explain more in detail what I just did today in an hour in a series of 7 presentations that go more in depth about what do we do in governance, what do we do in evidence, what do we do in practice. So we discuss each topic in detail, each one of the stages in detail, each one of the KPIs in details, and the progression for each one of them from not developed all the way to full compliance. So that's it. Thank you very much. And Laura, I'm ready for the questions and answers section.
Okay, wonderful. Thank you so much for sharing this wonderful, highly valuable tool and process. We do have several questions already, and just a reminder, please enter your questions in the Q&A box.
Yes.
So the first question is in regard to the certification strategy focus on AMR. Is it of a specific disease or pathogen, or after the completion of,
Yes. So I can answer that with a question as it is. So this is not a certification strategy. Again, the countries are not doing this to obtain certification, because different from foot and mouth disease or brucellosis or others in which the OHi is the ones that provide a certification of eradication or disease-free. AMR, right now, there is not a certification status to reach. Okay, as I said at the beginning, you cannot eliminate a biological natural process. This is only designed to really be able to have a very good knowledge and monitoring what is going on, be able to prevent it as much as you can, and manage it and control it when it's already there. So that's the first part of your question with regard to the certification. So there is, the countries is not pursuing a certification with the PMP. If you're doing a progressive control pathway, yes, if you have control in the title, it means that you are towards a certification, a free status. For AMR, we will never reach that free status, okay? So that's one point. In regards to the second part of your question for Dr. Dera is, it is not targeting specific diseases and pathogens. And the reason for that is those pathogens priority lists change from country to country, and it changes year to year, well, not year to year, but over time in the particular country. So normally it's designed when you do your assessment to see what are the top, for example, in practice, there is one particular topic about identify those pathologies that force the farmers and the professionals to use antibiotics in that particular country, in animals, okay? So that's assessment number one. What are the top 5 pathologies that create or force the use of antimicrobials in your country? And many of those pathologies are not necessarily bacterial ones, because we have identified in some countries that sometimes viral infections, like PIRS and others, produce secondary infections that are the ones that becomes multi-resistant. Those are the ones that will end killing the animals or producing morbidity. And those are the ones that force us to use antibiotics and then put the selective pressure and create antimicrobial resistance. Okay, so directly to answer your question, no, it's not for specific diseases and pathogens. However, in the tool, in the PMP, in the sections of practice, you are Part of your process is to assess those pathologies specific for your country, list them, prioritize them, and then your activities for education, your activities for surveillance, your activity for training, your activities for regulations, your activity for good practices, and so on, are going to be attached to that assessment you have done in stage one of that particular thing. And that assessment, for you to be able to go to the next stage, you need to do it on a regular basis. On a regular basis, it could be every 2 or 3 years, as we do it here in the US, because we have a very large agricultural production, it's very dynamic. And in other countries, we find out that if they do it every 5 years, it's enough for them to know what is going in the country. They are not that intensive, it's more extensive production. Some other countries, for example, Uruguay, do it every 10 years. Why? Because of the production system, those pathogens do not change that frequently. They have a passive surveillance in place, so they don't need to be doing these assessments every 2, 3, 5 years. They do it every 10 years. So every country is different, but the point for the PMP is that you have to have a system that allows to identify those high priority pathogens and then adapt all the other activities in your national plan to be able to cover those pathologies that you have identified. Sadly, I'm not able to see you to see if I'm reaching you, but if I answer your question, please let me know online, or if it's still not clear, let me know and I will clarify that. The second question that I see there, Laura, is, is there any country to be indicated as a model to accomplish most of the stages and got certificate? Yes and no. So again, hopefully the certificate part is clear. There is not a free certification for AMR. You will not reach, at least not at this time. Maybe 10, 20 years from now, when we know more, it will be something like that. Who knows? But at this time, do not exist. That's not the goal. So are there idea models? Interestingly, right now, there is not one country in the planet that is a stage 4 in every single focus area and every single topic and every single activity out there, okay? Even countries like Denmark or Norway, or some of the Nordic countries that are the kind of the gold standards in regards to antimicrobial resistant antimicrobial use, they're still in stage 3 in some activities, they're in stage 4 in many of them. For example, in regards to the prudent use of antibiotics and the control of the use of antimicrobials in regard to prescription, labeling, benchmarking. It means how much as a veterinarian I'm using compared with all my colleagues in the same sector. So I know if I'm using too much, I'm using just average, or I'm using 2 liter, I'm doing good. Those programs, they are in stage 4. But when we go to other areas, probably they are in stage 2 or stage 3. So there are most of the advanced countries in AMR and MOU, including the US and Canada, Japan, and so on. Most of their focus areas are going to be between 3 and 4. Most of the topics are going to be between 3 or 4 in regard to stages. 1 or a couple of them are going to be maybe in 2, especially when we're talking about crops and fruits and other agricultural sectors that is on the animal side, and which is perfectly fine. Now, when we go to middle income countries, then you start to see something different. Most of them, as the report in 2018 did, have national action plans, but they have not implemented. Or they started to implement it and then the funding is no longer there and they have to stop. Or they are not regular or constant or sustainable over time. So there is a combination of different situations. And then in low middle income countries, the problems we have seen in the food agricultural side, and that one is in my experience, is they don't have a national action plan that is specific for the food agricultural sector, or they have one that is only in paper, because when you go to in the field to do the audits or to do the evaluations or to do the assessments or the self-assessments, you find out that the veterinary diagnostic labs are not working. They don't have a training of producers. They don't have a training of veterinarians and so on. And then even though everything's in the plan and it's a well-written and designed plan, when you go to the implementation component, they are not implemented. So we predict that in those countries, when we apply the PMP assessment, probably they're going to be in stage 1 and stage 2 for most of the activities, okay? We don't know that yet, and that's the reason that this tool was created, just to see where you are as a country and then help you to move to the next stage, to the next step. Make sense?
I have a question
Right.
to elaborate on that. So in regard to the implementation, is there anything that FAO recommends to encourage implementation? Are there any repercussions for not implementing?
Very good question, extremely good question. So I'm going to, before I answer that, I'm going to give you a little bit of background, give one step back. The FAO, it is not a standard setting organization, okay? So standard setting means the World Organization for Animal Health, OAI, is a standard setting organization. So it means OAI said that if you want to commercialize cattle from one country to another worldwide, and you want to apply the WTO, the World Trade Organization rules, you need to be commercializing animals that are coming from free areas or a country that is free of foot-and-mouth disease. That's a standard. So if a country A want to commercialize on the WTO rules with country B, okay, they have to be certified as foot-and-mouth disease, or they have to follow whatever stage they are. So OAI will say, you need to do this to go to obtain that certificate. Okay, if they don't do it, then they cannot do it. So that's a standard setting organization. You are expected to do it. Now, can OAI force a country to do it? Of course not, they can. But if you want to be treated on the WTO rules of fairness and avoid protectionism, or be able to sue another country if they don't fulfill the terms of your agreement, then you have to follow the standards. Okay,
So
that's
there's
the
a big incentive.
Exactly. But when we go to FAO, FAO produce guidelines, recommendations, okay? It means that that's the action plan that is coming from 2021 to 2023. We tell them, if you really want to manage AMR, you should be doing surveillance in different critical control points through the food chain from farm to table. The country can use that advice and develop the plans to be sure that they fulfill those recommendations or guidelines. They can completely ignore it, okay? Mm-hmm. And the answer then to your question is, will they pay a consequence for that? And the answer is no and yes. So probably no. WTO, that's not a standard setting, that's not a rule, unless that is written in the codex, then the codex is standard setting situation, and FAO have a role in that together with WHO. But if it's in the action plan, that's just guidelines, that's just recommendation. So this is not. However, the impact that happen is a lot of the low and middle income countries normally will have to obtain funding from other countries, from donors, from these international organizations. So if I'm going to give you $5 million to develop your surveillance program or your AMR program in Laura's country, I would like to know what guidelines and standards that you apply. And if you're not applying these global ones, these ones that have been produced by experts like FAO, then I don't think that your program is that rigorous, and probably my $5 million or $10 million investment could be at risk, that we are not really doing anything. So it will make you less attractive or less competitive if you're pursuing that kind of funding. So it's not the same thing to say we created an action plan in a country with experts, local experts, and we follow international standards and guidelines, including, and then you put one that is international recognized, right? And if that's the case, you will be more competitive, you're more likely to get the funding to be implementing those programs out there. Make sense?
Yep, that makes perfect sense. Excellent, thank you.
So there are no standard settings, these are guidelines or recommendations.
Yep. There's a strong incentive. So
very much, it's a strong incentive. And again, I can tell you that I'm the best athlete of the planet. That's Armando's opinion. If Laura wants to be sure that it's true, you're going to ask me, okay, what are your metrics? What are you using to measure your speed, your performance? What is that? And then I will have to use, if I say baseball, well, it have to be something that Major League Baseball. Okay, I'm hitting this many percentage, 0.365. Wow, 36%, that's a pretty good one. It will give you something to say, yes, Dr. Hoet is a very good athlete. Make sense? So that's something very important. And that's what the countries are asking so much for the PMP. Selfish reason, they want to know where they are. They want to organize themselves. It's a very complex issue. There is over 100 and something activities and topics that they need to bring together into an action plan for them to really manage properly AMR. Because it doesn't matter that you educate the producers very well, if in the governance you allow them to buy antibiotics in any supermarket and use it or whatever they please, then you're not really controlling. So you're doing a lot of education, yeah, but your laws are so low in the stage that you are really not managing AMR properly. You're still putting selective pressure. You still will have animals and people being affected by multi-drug resistant pathogens.
Excellent. I was going to just ask one more quick question for, I see we have some other questions, but do the guidelines generally recommend surveillance in environmental and wildlife samples?
Yes, there is a major component in PMP and the different focus areas in regards to environment. Okay, the water quality, what the quality of the water that you serve the animals or that you use for irrigation of the crops and fruits and things like that. It is extremely important. So there are different stages for you to go from you don't know what is going on in the environment, in the agricultural environment, to a stage 4 in which you are monitoring, you're managing, you're planning intervention, you're educating people. That's your stage 4 for the environment. That also include the feed for animals. And that also include not only the monitoring prevention, but also the research, the testing of the interventions and things like that to be able to improve that. So short answer to your question, yes, they are included because you cannot manage AMR in an animal production system if you cannot manage it in the environment, if you cannot manage it in the feed or the food supply, in the water supply. Mm-hmm.
Excellent, thank you. All right, well, we have
here, yes. Do you want me to read it or you?
Oh yeah, if you'd prefer to read it, go ahead.
So I was wondering if Ethiopia missed it from your presentation. Part of this important program, participating services, will be a great importance as we do not really know how much of a problem AMR is because the lack of information. That's true. I don't know if you know, but I work in Ethiopia since 2011. I have a OIE program with the twinning program with the University of Gondar. I know that the Ethiopian AMR point of contact of the country have been in conversation with the FAO regional office, the one at the country and in East Africa, to trying to implement the PMP in Ethiopia. And I believe, if I'm not mistaken, it's also part of the multi-partner trust fund or something like that. Bottom line is, yes, I know Ethiopia is in the conversation. I have not seen yet coming to our teams to set dates and times for that. Normally there is a training, like for example, we're doing Morocco next week, and we're doing Senegal and Kenya in the next couple of months. I don't remember. That doesn't mean that it's not happening because I'm not all the time there. It's just a percentage of my time. I'm not sure, but I know Ethiopia have been in the mix. Ethiopia will gain a lot by doing this assessment to see where we are, in what stages are in the different areas, in the different topics, to allow us to set a plan and then to go to international organizations, to governments, to donors, to partners, to the industry, and to the Ethiopian government to say, okay, we want to move from stage 1 in this is what we need to do to go to stage 2. And so definitely very, very important. So hopefully, I don't know, Dr. Sejum, if you know that person or you are that person in Ethiopia, reach to Dr. Cohen, that is the head of the PMP program. Again, the email is in the presentation. I will send a PDF later to Laura once FAO have provide clearance. And then we can engage in a conversation. And I will love to be one of the facilitators going to Ethiopia to do the PMP over there as we have done in other countries. As a matter of fact, I'm going to be in Ethiopia in October, knocking what for a different project with my colleagues from the University of Gondar. I hope I answered your question.
Great. All right. Well, and if we have further questions, please go ahead and enter them in the question box. And I think that answers that. Yasu, let us know if you have any further question in that regard.
So while they type their question, I would like to acknowledge some of my colleagues, Dr. Desale and Dr. Ashinev, that I see them connected. Hello, doctors. They are have been our partners in crime in putting the University of Gondar GOHi twinning program in Ethiopia. And they have developed the first GOHi harmonized curriculum for the veterinary education in Africa. And that was used as a model in 2019 to apply it across the country. So we're very proud of that. The Villa Melinda Gates Foundation have funded the expansion of that experience to the whole country, and it's going to be moving to Southeast Asia and India in the next couple of years. So there and Dr. Segat, Dr. Selesh, and other colleagues from the University of London have been quite influential. So I'm very glad to see them in this call. Good morning, both of you.
Wonderful, very exciting.
Yes, indeed. So I see there is no more questions or comments.
Yeah, it looks like if we have no further questions, we can go ahead and conclude. Thank you so much, Dr. Hoet. This has been a wonderful presentation. And yes, this is highly valuable. I think something we should all be aware of moving forward. So I'm glad to see it progressing. And thank you so much. And with that, we can conclude.
Thank you, everybody. See you soon.
Bye, everyone.